Dear Lagosians, good evening. I'm here again to update you on the COVID-19 situation in Lagos. Since my last address to you on Tuesday, March 24th, 2020, we have seen an increase in the number of confirmed cases nationwide, with Lagos having a significant number of those newly confirmed cases. Our numbers have grown up from 29 earlier on Tuesday, as at the last address, to 44 as at this briefing this evening. Of these 44, 6 of the additional 15 that we've seen were from an intervention vessel offshore out of Lagos here. The health authorities promptly quarantined the vessel and ensure that the crew were all duly tested. I'm sure this shows clearly that our surveillance and our tracking system are functioning and they are working well. As things stand now, most of the cases we're dealing with have been imported cases. But we're also starting to see a trend that suggests that we may be entering a phase where community transmission of the disease could also be coming in. Fortunately, because we have shut down all the land, sea, and air borders, we are now able to fully focus on tracking and halting within our communities. I'm pleased to also know that all our confirmed cases are doing well and they are all in stable condition. Of course, we know that a total of 3 have since been discharged. And in fact, as I read this address, we are in the process of reconfirming another 5 or 6 additional patients that once they turn a second negativity, they might be allowed to go home later tonight or tomorrow once the results are out. These, I imagine, are good news, and we are hopeful that we'll continue to see a swift recovery of this nature, even as we scale up our contact tracing to ensure that every case that is already within our shores are identified, they are isolated, and they are properly treated. Fellow Lagosians, I'm also not unaware of the effect of all our restrictive interventions and the consequences, especially to our people. Particularly, we realize that the consequences of the restrictive order will have on the very vulnerable sector of our economy. It is also a fact that we have people who, because of their daily means of livelihood, have been affected. And so we needed to have some stimulus package set out immediately. So earlier today, I visited one of our 20 identified food banks that we have established across the metropolis to cater for feeding of our people. We are, by this intervention, targeting those who earn daily wage to feed their families, those who are vulnerable, what we consider as the lower part of the triangle, the elderly and the physically challenged. They are the ones that we're looking at to see how we stamp out food bank for them. And of course, for us to also be very fair and be transparent with this process, we're also looking at our existing database for Lagos Social Register of Poor and Vulnerable amongst us, which certainly cut across the 377 wards. So at the first instance, we're targeting a food bank for about 200,000 families, 200,000 households. An household will consist of a father, a mother, and 4 children. And so we're providing stable food such as rice, beans, gari, bread, pepper, water, in a full package to each and every of these households that we're identifying. And so all these food banks are going to be at our various local governments, and I think we're starting out, if not later today, by tomorrow, and we're good to go, and to ensure that we reach out to all our various local governments. I'm also happy to inform you that we have formally launched what we call a neighborhood market, which we have identified 50 large public school premises across the state that can accommodate temporary open markets where all essential food and household materials, daily essential materials, will be available for sale at affordable prices. When I mean at cost prices. This neighborhood market will operate every 2 days, meaning that if they come to a particular location today, in 3 days' time, 2 days will be off, they will come back to that same location. And so we're targeting 50 of such neighborhood markets right around our massive big public schools. This, we believe, would help achieve a number of goals that are in line with our guidelines of a healthy nutrition. Will also reduce the incidence of people needing to travel across various locations to try and get into a market. So that's why we have set up this neighborhood market to ease the commuting and the travel time for our communities. As I've always stated, I want to also reiterate again in very strong terms that let us refrain from gathering or congregating in any kind at this time. We have put in place palliative measures that will cushion the effect of the restriction. We would expect maximum compliance from you. That is the least, at least, we will expect from all of us. After this briefing today as well, I will also be signing what we call the Lagos State Infectious Disease Emergency Prevention Regulation 2020. It's an exercise of my power conferred on me by the federal and state laws. These regulations will give legal and enforcement backing all our actions that we have taken so far. And it would help us ensure that we contain the spread of COVID-19 within Lagos State. They also prescribe stringent penalties to all those who defer or fail to comply with the directives that will be issued in the regulation. The devastating images and stories from other parts of the world should serve as a warning and a lesson to all of us in the country that this pandemic is serious and it can still double up in our community if we're not careful. While we must refrain from undue panic, it is also very important for us to be very realistic about the situations at our hands and to remain committed to acting sensibly and responsibly as individuals and as citizens. I want to also say and reiterate that we're in this together. As Lagosians, I want to imagine that we will come out of it well, stronger, and better. But I want to put on notice and acknowledge the support of the private sector that we're receiving so far. But I think it's important at this point that I also thank first the federal government of Nigeria under the able leadership of President Muhammadu Buhari for supporting the state government with a huge generous grant. We would also especially thank Mr. President for his leadership, role, and support, and for recognizing Lagos as the epicenter of this pandemic in our country. And our pledge is that we will continue to work in cooperation with all of the federal government organs as a state under his able leadership. We will also want to thank members of the organized private sector who have been collaborating with us at all of the efforts we're seeing around the building of isolation centers, donations in cash and in kind. Some are giving us equipment, medical supplies. I will be acknowledging each and every one of them in due course. I also want to thank and extend gratitude to a very important community, which we'll call the FMCG, which are fast-moving consumer groups, all of the big conglomerates that have household products. They are the ones that are partner and will work with us at the 50 neighborhood markets that I've highlighted earlier. They have been of great support, and we're believing that all the produce and products they'll be bringing will be at cost. So I want to thank them on behalf of all Lagosians ahead. Let me also restate the fact that these indeed are very difficult times for all of us, and we need to act fast and responsibly. Urgency is critical, just so that we can reduce and stem the growth of this in our community. Some people think that the virus is for some set of people, or is for a rich, or for some part of the community. I think it's important for us to reiterate again that the disease is not a respecter of anybody, be it rich, be it poor. It doesn't look at gender, class, or race. So everybody is at risk. And that's why we keep saying to all of us to restrain and obey the rules and regulations that we have set for ourselves. I'm sure you're also aware that we have started fumigation and the insectification of the whole community. We have about 200 machines that we have procured, and they had started work today. We'll see a lot of work tonight, tomorrow, and on Sunday, and thereafter. And so the disinfection is to cater for all our public areas, parks, markets, bus stops, and all of our highways. They will be entering each and every of those communities, and they will start spraying. They are non-toxic sprays, so they are not harmful, but they will probably just be able to kill the droplets of the virus that are in our community. Earlier today as well, this evening, I was also at the EOC, which is where we have the infectious disease hospital in Yaba. And on behalf of all Lagosians, I needed to go there and encourage the medical personnel that are working there, to say to them that we appreciate what they're doing, to encourage them, and to say that our prayers and our best wishes are with them. I also saw for myself that some of the patients that we were expecting that will be discharged, that they've started attending to them. And also, I think it's also important that whilst I was there, overnight, we had to rescue about 14 Nigerian students that were stranded at the Seme border. I'm happy to inform that they've all been brought to the hospital this evening, and all of them would be isolated, and they will need to go and have themselves tested. If they all turn negative, we'll allow them to go home and be joined with their family, because I know that some of them, their parents are pretty anxious right now, but they're in safe hands. I saw them, and I said to them that they don't have anything to worry. This was something that I had to have a conversation with the controller of immigration last night, because they were stranded at the border. But we're happy that they are all with us now, and we'll just conduct the test. And once we're satisfied, we'll let them go back and reunite with their families. I think our collective effort is therefore required to defeat this pandemic. And it is only with our cooperation, with all of our cooperation, that will achieve the desired goal of arresting this disease in its track and preventing it from escalating beyond control and imagination. I want to thank you again for listening. I think we'll just take a few questions or clarification that you might want. The Commissioner for Health is here, and also the Commissioner for Information. Thank you very much, gentlemen of the press.
Thank you very much. Journalist questions. Can you just indicate and I'll bring the microphone to you?
Tanya, all right. Mr. Governor, can you hear me? We've acknowledged the fact that you've announced the food packages as part of that type of stimulus, but I wanted to ask whether or not there are plans in place for a direct financial incentive to ease economic hardships. And in addition to that, I acknowledge that you've announced the creation of neighborhood markets so that would ease the need for people to go out onto the streets. But are there any other plans in place to restrict movement, something like an interstate border or a curfew? Are you moving in that direction anytime soon?
Thank you very much for the question. The last part of it is, are we moving in direction of curfew soon? Yes, we are. There are indices that needs to happen. There are numbers that we need to see for us to know that we need to shut down everywhere. But we haven't seen that number. Like I said, as we're having cases coming in, we're also excited because we're seeing very positive response, and we're seeing very positive patients also at the edge of being discharged. So that, for us, shows that there's some balance that is coming in, and so we're checking it. You know, where there's some numbers at the EOC today. They told me that there's some number that we need to see. We need to see a huge spike, right? And we'll know that, yes, maybe we're indeed there. And we'll probably get to that. But first part of your question is, what are the other stimulus that we're looking at? We're looking at our data. We'll probably do that at some point, but we're looking at, data is something that is critical. We need to know, how do we access the truth? It's the food bank is very easy. I can identify you, I know where you are, I can come to your residence or and I give it to you. But other things around cash rationing, there's a lot of other crossing the T and dotting the I's that needs to come to that. But it's not out of place for us. Yes, we will consider it, at some point in time.
Good evening, Governor. My name is Theophilus Elama from TVC. I'd like to ask now, yes, the Lagos State government is doing well as regards curbing the spread, but in the event that there's a community-wide spread, have you identified the communities that this might happen?
Thank you very much. So, earlier this afternoon, too, the Honorable Commissioner did a presentation in Alausa, and he was able to graphically and empirically show us what and where has been the prevalence. In Lagos, the highest local government in terms of what we've seen is Etiosa and Ikeja. So that for us is, we know. So we know where the highest numbers of patients or the prevalence have appeared from. So we have a graph that shows where, so that's the community, or that is a host place where we can sort of like narrow down and pinpoint. So it's Etiosa, Ikeja, and in that manner, and I'm sure he can say that because I saw his presentation and I know that he has we know the number, if it's male, female, we know the trend, and so we have it all and we're watching it,
Good evening, sir. My name is Titulari Abero from Channel 7. We would like to know how the neighborhood markets would operate. Will they be distributing the food items door to door? And also concerning the public transport system, most of those yellow buses are not still complying with the laws on ground, of not carrying more than 8 passengers and all of that. What are you doing in that regard, sir?
Well, thank you very much. So the neighborhood markets are open markets. So what we've done is we've identified our public schools that have huge grounds, and that's the first consideration, and is well safeguarded. That's the first consideration. You must have a massive playground. So what we're going to be doing there, you'll see there are going to be different stalls that are well separated and are distant, right? So you'll see different companies bringing day-to-day daily needs, daily essentials there, and you also see produce, like a typical farm's market, also coming in there. So people can come in and do some daily shopping that they will require, right? But it's all going to be on a massive ground. The whole idea is we don't want people to need to travel distance to the very big markets that we have. And we also need to slow down, the interaction at the big markets. We need to slow down people struggling at the very big markets that we know, and so that we reduce traffic, and the population in those markets. So that's why we've worked this out to very quickly create these 50 new neighborhood markets. So they'll be using the ground. So they'll be selling. That's why I have acknowledged them and I've thanked them. They'll be selling all of these things that at like cost price. They will be like the retail, the wholesale prices that you probably not even get in the market. So, and they will ensure that you are not buying to go and resell. So when you come and you say you want to buy 10 cartons of something, that certainly does not come under your daily needs. That means you have other needs or you have other plans for that. So those are some of the workings that we have agreed with them. Regarding yellow buses and the drivers, I think the first thing is we just need to help ourselves. If you don't have a need to go out, please don't go out. That's rule number one. Rule number one is stay indoors. It's only if you're on essential service that you've been allowed to go out. And rule number two still comes down from rule number one. Stay indoor again. So it's really for us to tell our people that the first and the second rule is for us to not go out. Is to stay indoor. Whilst we do not want to shut down the entire economy, it's like I said, we understand that it's an economy that still needs to run a little bit. But like I said, once we see the numbers that we do not want to see, it will happen.
My name is Omolara Amosoya and I work for Radio Nigeria. Sir, you said the food pack you are going to be providing for the less privileged, you handed it over to the local government. I would like to know the mechanism you have put in place so that this will not be hijacked and turned into a party affair, because we've witnessed such in the past. And secondly, how do you identify the most vulnerable?
So like I said we'll have a database that shows the poorest and the vulnerable, and that's why I said transparently that the first set of people that we'll be dealing with, we have about 75,000 in that household, the very vulnerable and indigent in our community. So that database is with us, and we're working right down to our wards, right? So mentioning local government doesn't mean that we're taking anything to local government. We're actually taking it to the wards, where they congregate. That's really where we're taking it. So we've done a lot of statistics in the last 2-3 days, right? And so we'll imagine that we will have some glitches here and there, but we're hoping that we'll be able to, for the first 200,000, we're hoping that we'll get, 70 to 80% success, and let's be real with ourselves, 70 to 80% success to be sure that it gets to the vulnerable and the less privileged amongst us. And by the way, the package we're giving can serve that household for 14 days. The package that you'll be getting can serve you for 14 days. The whole family, it's enough to feed you for the next 2 weeks. And that's what we're bringing together, for them.
My name is Maritala. I write for New Telegraph. Mr. Governor, sir, I'm interested in knowing some of the provisions of the bills that you're about to sign into law with regard to the management of COVID-19. What are the do's? What are the don'ts? What sanctions are we those who flag those laws?
Well, okay, so law is not something that I'm very good at. So the lawyers will tell you that we're educated, not learned. So once I sign it this evening, I'm sure it will go viral and you'll be able to read it. I do not want to say provisions in the way in which I shouldn't say it, but my Attorney General is here, and you can also still speak with him after this address. But he has advised me accordingly, and so I'm happy with what he has advised me.
Thank you very much.
My name is Thompson. I report for AIT. My question is with regards to the chloroquine that the commissioner once told us that there is sample testing of sort in the state. So I want to know, are there some positive response to the usage of chloroquine? Thank you.
It's not my line.
The evidence is growing worldwide that chloroquine has some benefit in the prevention and treatment of COVID-19. But we have advised that chloroquine is a toxic drug. It is not to be used without medical supervision. So we do not advise any members of the community to go and self-prescribe or to use chloroquine. If you are in our jurisdiction in the isolation ward, we may choose to use it if we feel that it's going to add benefit to your profile. We have other drugs at our disposal that we can use and are using. So chloroquine is becoming one of the drugs that is in our armament to treat our positive cases. We are commencing a clinical trial in the Ministry of Health in collaboration with the Nigerian Institute of Medical Research and the Nigerian Center for Disease Control to test the efficiency of chloroquine in our environment. Remember, environment is different, ethnic race is different, so what works in China or America may not necessarily work. So we need to put it to the test, and we're going to speed that clinical trial so that we can start to see some answers to advise the medical professionals on how to use chloroquine in the medical setting, supervised by medical practitioners.